And to recap our session is Dr. Peter Quiros.
Well, thank you, everyone, for attending this morning's session. Just to recap this second session, bugs and drugs, do they matter? We learned from the first case that, these are my financial disclosures. They are not relevant to this discussion. And finally, in the first case, we learned that medication review and social history are really key, especially when we have patients with a bilaterally, slowly progressive process that doesn't fit with quite the basic clinical picture. And then stopping the incident medication in these cases may improve vision, actually. So there's a very good reason to pick up that phone and have that discussion with the prescribing physician. Just telling the patient is probably not enough. In the second case, we learned that myriad constitutional symptoms and diplopia, especially in an elderly patient, should always raise concern for giant cell arteritis. And that choroidal non-perfusion on fluorescein angiography can actually be very useful in suspected cases, especially when the visual symptoms are vague or maybe even absent. In our third case, we learned that we need to look at the scan, and I think that was reiterated throughout the session, or at the very least discuss it with the radiologist. Remember, Dr. Cockerham pointed out, radiologists look at films all day long, and it's picture after picture after picture, and unless they're told what to look for, they may not find it always. But if you just call them up and say, hey, can you look at that apex one more time? Because that's where this lesion looks like it's present. You sure that apex is clear? And you can feel much better about that scan being truly negative. We don't expect you to be able to read these scans because you don't do it every day. And then also biopsy. And if it's negative, maybe biopsy again because they may not have gotten the right amount of tissue. In our next case, we learned that patients with papilledema often have normal vision and maybe even minimal visual complaints, and that these patients can have drusen, and drusen patients can still have papilledema. This is where an FA, which is your test, can actually be very helpful to differentiate the patient that has only drusen or the patient that has true papilledema. And always remember to ask about secondary causes, as topical medications, oral medications, and supplements can often have an effect on intracranial pressure. And finally, we learned that optic neuropathy with intraocular inflammation, it's syphilis, 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 as my uveitis specialist, Dr. Holland, likes to say. But you must consider infectious and inflammatory causes in these cases. And in cases like this, it's okay to hold off for a few more hours on that treatment to wait for that RPR to come back, because they do come back pretty quickly. The lab's very happy to call you when that titer is 1 to 1,000 dilutions. And finally, if we could please have the point-counterpoint question back up for you to vote one more time. And that point-counterpoint question was, should NAION be treated with medication? Yes or no? If you could please weigh in. I'm going to weigh in as well. And we'll see if we changed any minds in the next few seconds.
What was the percent before?
And our results are, well, it looks like we didn't move mountains here. But the vast majority, I think, people agree that because there's no proven treatment for this disease, we really shouldn't be grabbing for straws, because we really should be doing no harm. So I want to thank you all for attending the morning session. We will reconvene for the afternoon at 1:17 p.m. Lunch is being served directly outside. There is additional seating available on the second floor. See you this afternoon. Thank you very much.